Hi, I'm Matthew Stamp. I did my video on dry needling versus acupuncture in Virginia. My topic of focus is dry needling versus acupuncture in the state of Virginia. I had been watching this closely when I was an acupuncture student at VUIM since around 2014. I participated in a Virginia state petition that went to legislation opposing the use of filiform needles in the hands of physical therapists. At the time, my view was that it was unfair for PTs to be able to take a weekend course and get certified to be able to do essentially what is deemed acupuncture. While many acupuncturists opposed the use of dry needling in the state of Virginia, it was a losing effort from the beginning. In June 2017, the Board of Physical Therapy's Regulatory Advisory Panel met discussing guidelines for dry needling. The panel consisted of 8 members with only one representative of acupuncture. When it came to voting on the definition of dry needling and the regulatory, the vote and the regulation, the votes were 7-1 in favor of dry needling, with the opposing voice was that of the acupuncturist. The governor of Virginia eventually approved the proposed regulations in December of 2017. According to the Acupuncture Society of Virginia website, they did reach out to council and requested a memorandum of what it would cost to have a lawsuit against the Board of Physical Therapy. However, the cost would be over 20 grand, with a negative prediction if the Acupuncture Society of Virginia would file a lawsuit against the Board of Physical Therapy. How does this affect acupuncture in Eastern medicine? There are several ways. Dry needling affects acupuncture and Eastern medicine. The general public is often unaware of the difference between both. For example, dry needling is based on Western medicine treatment of neuromuscular dysfunction, while Eastern medicine is based on the whole person's flow of qi and the channels and meridians. This, of course, can hurt the perception of our business, as physicians may think that these are actually the same thing and refer patients off to physical therapists rather than an acupuncturist. This also limits the public's perception of what we do. The average person may think we just put needles in a muscle and not understand we have specific points that have specific uses other than muscle dysfunction. We as acupuncturists use more modalities as well, like moxa, guasha, cupping, toina, and herbs that may help with muscular issues. Safety is another area of concern that affects Eastern medicine. We as acupuncturists have way more training and clinical hours with the needle, but that does not make us exempt from the dangers like pneumothorax, as there are cases of this happening in both acupuncture and dry needling. The way it affects us is taking away from our profits and patient numbers, as the unaware citizen may choose dry needling over acupuncture based on word of mouth or lack of education of the differences in the general public. This is a Venn diagram with some pros and cons of this topic. Um, Take a look at the center, because this is kind of like where we both do the same thing. We both use filiform needles. We can both treat trigger points in myofascial pain. We can both palpate the patient's muscle areas and treat with a needle. However, in acupuncture, we have 1,000 hours of clinical training. We go to a accredited college. We have the NCCAOM boards. We have clean needle technique. We have ongoing CEUs. Dry needling, um, basically, they can take a 24 to 50-hour weekend course. There's no ongoing CEUs. There's no regulatory body or formal training requirements. Now, acupuncture is allowed in 50 states. Dry needling is not. Over time, I've actually taken Sun Tzu's Art of War in my approach to understanding dry needling. Keep your enemies close. Study what they do. Find understanding of their principles. Just as a wrestler going to fight a boxer needs to have a full understanding of a boxer's jab, cross, hook, and uppercut combinations and defenses, we as acupuncturists need to fully understand what exactly our physical therapist doing with the needle. With that said, I've worked with acupuncturists who have gone and done myofascial pain trigger point seminars. I have the book Trigger Point Dry Needling by Jan Balmerholt and Cesar Fernandez de la Pinas to investigate it further in times I have leisure to do so. Some additional pros and cons. For dry needling, some pros are the methods that they are using dry needling actually are not taught in TCM schools. As much as we want to think we are doing exactly the same thing, no, we are not. PTs are working with the muscles from origin to insertion and look for taut fibrous bands and putting the needle there. They might fish around, going at various depths and angles to break up fibrous bands. Often a muscle twitch or spasm can occur during this process, giving the patient some relief. However, some of the cons are the patient often reports being sore for a few days. While in acupuncture, we can put needles on the Jingjian sinew channels, and we can palpate these and find pain spots and put needles there. And we can additionally put needles on the Jingluo, the primary channels, to assist. We have other techniques to assist like moxa, guasha, 7-star needle cupping, tuina, and herbal formulas. The cons, as much as we think we're doing the same as dry needling, we are not. Physical therapists have a different understanding of muscle anatomy and differ in their method and approach. Anyone who has had both dry needling and acupuncture will tell you they are not the same. What is the suggested plan for next step? Public education will be important. We should educate our patients on the differences between acupuncture and dry needling. We need to be open-minded as acupuncturists and going as far as even taking a course in dry needling to better understand the method and techniques. This might give us the upper hand in treating our patients. Some theorize that dry needling is simply muscle tissue acupuncture brought back from China by French Franciscan monks. We need to encourage TCM schools to have courses or seminars in dry needling to compare and contrast, have a better understanding of the pros and cons of dry needling. Does Virginia need to take the Board of Physical Therapy to court and try to have dry needling banned in Virginia? I do not think this is the right approach based on counsel's prediction that it would not overturn the decision.